Which is better, a rotating or sonic brush? There are two basic categories of electric brushes, rotating or sonic. Rotating toothbrushes do exactly what their name implies. They are circular brushes that rely purely on mechanical rotation. Sonic brushes are different. Most of them have a head like a regular brush. Rather than rotation, they rely on sonic vibrations to remove plaque and biofilm from the tooth surface. Sonic toothbrushes are rated by vibrations per minute. Depending on the model, they can range from 15,000 to 60,000, with 30 to 40,000 being ideal. So which is better? To cap this debate, we'll examine three critical aspects of each: the techniques required to use them correctly, potential risks, and the research behind them. The first major difference between the two types is in their techniques. The rotating brush was based on the polisher used by hygienists during a dental cleaning. Observe how I use it. I start at the back side of the last tooth, turn it out towards its side, and then turn it in toward the front where it meets the adjacent one. It's an in and out motion. You have to think of the brush as a single tooth toothbrusher. In addition, you also have to ensure you are carefully angling the brush toward the gums, and then repeat that same motion on both sides of your teeth, as well as taking it across the biting surfaces. As you can see, this does require mindfulness and dexterity. If you're one of those folks who grabs their toothbrush and randomly goes back and forth in a rapid horizontal motion, as you may have been taught as a child or seen on TV, a rotating brush will actually spin plaque between your teeth and defeat its intended purpose. The minute I look in a patient's mouth, I can almost always tell when they're using a rotating brush incorrectly, because the spaces between their teeth look like this: heavy plaque buildup or notable interproximal stain, which, besides looking displeasing, can lead to dental issues like cavities and gum disease. This does not mean that a rotating toothbrush cannot deliver good results. It just means you must use it correctly. Because using a rotating brush requires more dexterity, people who struggle with hand movement, especially children and the elderly, would be better served with a brush that is easier to use. Sonic brushes have a much simpler technique. You just approach the sides of the teeth at a 45-degree angulation and slowly use it as a gum massager, along with a pass across the biting surfaces. For ease of use, sonic brushes have a clear advantage over rotating. The second point to consider is risks, especially how a brush might control or exacerbate gum recession or tooth abrasion, two significant issues many people have. Recession is when the gums pull away from the teeth. Abrasion is when enamel or exposed dentin is ditched out by mechanical forces, usually with an aggressive brush. The majority of this is seen in people who use a stiff manual brush with a heavy-handed motion. However, there is legitimate concern that rotating brushes with stiff bristles pose similar risks. Recession and abrasion are significant issues. They generally make teeth sensitive and vulnerable to new problems. Managing gum recession is a catch-22, however. Aggressive brushing will exacerbate it, but if not thoroughly and gently cleaned, new inflammation will cause even more recession. Toothbrushes with pressure sensors and soft bristles are helpful in this situation. Still, because of their gentler action, sonic brushes with or without pressure sensors offer a lower risk for both recession and abrasion. On safety for your gums, sonic brushes also have an advantage over rotating. The last point we'll consider is the research. One of my pet peeves, now that I'm on my third graduate degree, is listening to healthcare providers say they prefer one brush over the other because it has better research behind it. 9 times out of 10, the so-called research is a paper written and paid for by Philips, who makes the Sonicare, or Procter & Gamble, who owns Oral-B, comparing their products with predictable outcomes in favor of whichever company paid for it. That's not research. It's expensive advertising aimed at dental professionals whom these corporations are banking on not reading their conflicts of interest statements, usually buried in fine print at the end of these so-called studies, or analyzing the data, which is typically weak and biased. Most independent studies agree that electric brushes, both sonic and rotating, reduce plaque and biofilm better than manual brushes when used correctly. On this point, both sonic and rotating brushes share an equal advantage. However, some studies show that sonic toothbrushes can stimulate salivary flow, a key element in cavity prevention, giving sonic brushes yet another advantage. In contrast, several case reports show rotating brushes have caused physical injury in children and triggered seizures in epileptic patients, a clear disadvantage for the rotating brush. If you want to check out the references on these issues, you can find them on my website's blog. So which brush should you use? Frankly, whichever one you will use consistently and correctly. Everyone is different. Some people have low risks for dental issues and can manage their oral health just fine with a manual brush. Some people like and use rotating brushes correctly. However, it is my opinion, based on years of experience, that sonic brushes predictably give the best results in oral hygiene. To see the ones I have currently vetted and recommend, go to my website and look under Recommended Products and then Toothbrushes. If you found this information valuable, I would really appreciate you clicking on those like and subscribe buttons below so that I can reach more people in Google's algorithm and hopefully help more people smile.